Good morning and welcome to our January Dementia Dialogue titled Advocacy and Legislators. My name is Heather Mulder and I am the Outreach Program Manager at Banner Alzheimer's Institute, and I will be your moderator today. A bit of new information before we begin. We've made some changes to our Dementia Dialogues this year in response to feedback that we've gotten from participants. We are still holding our dialogues on the third Wednesday of each month, but we've slightly shifted the time of day, starting now at 10 in the morning, and we've shifted the length of the webinar as well, so we'll just be going for a half an hour today. This year's theme, we are in a pursuit of answers. Caregiving seems to bring forward so many questions, and so each month we're going to take a different question and examine it with local experts. This month's topic, we're going to examine the question, how can I use my voice to inspire broader social change and increase research funding? Before we begin, I want to introduce you to our esteemed panelists today. Suzette Armijo is a Senior Outreach Ambassador for Beatitudes Campus in Phoenix. The majority of her 6 years at Beatitudes has been within their caregiver and home care programs, Beatitudes at Home and Beatitudes Home Health. Suzette inadvertently became a caregiver for her grandmother who was diagnosed with Alzheimer's disease. Because of this experience, she got involved with a local Alzheimer's Association chapter on their public policy committee. Since then, she's traveled to Washington, D.C. on 7 occasions to meet with policymakers, as well as been appointed to the Alzheimer's Association ambassador to Senator John McCain, which kept her in touch with his office to keep them in the know on coming legislation and advocacy efforts to support the fight against Alzheimer's and dementia. In the last decade here in Phoenix, Suzette has begun CADA, Central Phoenix Advocates for Dementia Awareness, which focuses on education, awareness, and advocacy efforts. Welcome, Suzette.
Thank you, Heather.
Our second panelist is Bonnie Goldsmith-Danowski. Bonnie was the primary caregiver for Jim, her husband of 49 years, from the time he was diagnosed with MS in 1971 until his death in 2013. Bonnie has received numerous recognitions and awards for her lifetime of advocacy work on personal and policy levels. Her major focus is in healthcare, with the primary focus of improving lives of family and informal caregivers of those with physical and mental illnesses. In 2007, as a leader in Valley Interfaith Project, a broad-based organization, she co-wrote legislation, spent countless hours organizing and strategizing with citizen lobbyists, forming coalitions, speaking with national and state lawmakers, and testifying in committee hearings. On the state level, this work resulted in the Arizona legislature passing the Lifespan Respite Care Program, which benefits hundreds of family caregivers in Arizona. Bonnie was the co-founder of the Arizona Caregiver Coalition and has provided leadership in the National MS Society and remains committed to doing all that she can to affect the lives of caregiving families. Welcome, Bonnie.
Thank you, Heather.
And our third panelist today is Kathy Ritchie. Kathy likes to describe caregiving as being in the meat grinder. At least that was her experience helping to care for her mother who had frontotemporal degeneration. Kathy spent her formative years in the Valley before moving to New York City to pursue a master's degree in journalism. Kathy never set out to become a caregiver, and she'll tell you she was not very good at it. Nor did she plan to stay in the aging and caregiving world after her mother passed away in 2014. But during the course of her mother's illness, she felt the need to speak up about what was happening to her mom, sound the alarm whenever she could, and share her story with anyone who would listen, as well as her mother's story. While her mother was alive, Kathy chronicled her experiences in a blog called My Demented Mom. She plans to launch a new blog about life after dementia called The Recovering Caregiver, where she'll interview experts and caregivers. Kathy also co-founded a community group called the Central Phoenix Advocates for Dementia Awareness, along with Suzette of the Beatitudes campus. CADA's mission is to connect caregivers and organizations to one another. She has also been interviewed by the Arizona Republic, the Huffington Post, and the Alzheimer's Speaks radio show. Welcome, Kathy.
Thank you.
So you can tell we have a very dynamic panel of presenters today, and I think this is an incredibly important topic. How do I use my voice to inspire broader social change? And as I was researching this talk and figuring out what we wanted to cover, I came across an article in the New Yorker called "What Calling Congress Achieves" by Catherine Schultz. The first line of the article says, "Of all the liberties guaranteed by the First Amendment to the United States Constitution, the most underrated by far is the one that gives us the right to complain to our elected officials." And I feel like this is almost a common feeling among individuals. We're encouraged to contact our legislators, but we don't necessarily know that our voice has impact. So my first question to all of you is, why is it important that we speak to our legislators?
I think you have to share your story, your personal story. I think it's great to go, obviously you have to go in armed with facts and statistics. I think Bonnie would agree that you have to know what you're talking about. Suzette would agree, they've done it. But I really think quite a bit of the impact comes from your sharing a very raw experience that illustrates the problem. And I think they respond to that because they hear from lots of different organizations, lots of different nonprofits, and everybody has a story. But I think if you can find that nugget in yours where it's just really compelling and really profound, and it's hard to do because you really have to narrow it, you don't have a lot of time, but I think if you can get to that, I think you might move the needle a little bit, just a smidge.
I agree. This is Suzette. I think the biggest thing that we can do with our personal story as a constituent, so not as a lobbyist, but as a constituent with our own caregiving story especially, it's very empowering. You know, there might be somebody else on the receiving end. It could be an aide in the room. It could be the legislator themselves, or just someone else that maybe hasn't had, they just haven't been able to stand up and speak yet. And they're hearing you and they're like, you know, I can do this. My story is painful just like that. And look at them, you know, sharing their story and maybe even sharing some tears or maybe getting emotion out of the people in the room. And that's what it's all about. It's life. It's not necessarily just the policy out there we're trying to move. We're talking about people's lives here.
I agree with all of what both Suzette and Kathy said. This is Bonnie. I know the value of it because I've experienced it firsthand with the work that I did at the legislature a number of years ago, and the work that I've also done in Washington. The stories that are, we can have the facts, but until we reach their hearts, nothing works. Right now, the funding is so low that it's really difficult. And I guess I would wonder about the word complaining. I think it's more bringing, this is what's happening in the world, and this is what's affecting our families, and this is what it's costing in the long run. And it's not just the cost, not just an economic cost. It's a social, and it's a physical, and it's a mental cost that's going on in our families. And we're taking people out of the mainstream and hiding them away still, it seems like. And until there are adequate resources for all families, because all of us are affected in this in one way or another, nothing is going to happen. I can remember speaking at committee hearings here when I was with, and Heather gave my bio, when I was with the Community Value Interfaith Project, and speaking before a committee about my husband's illness. He had multiple sclerosis, and what it was doing to me and my sons. And people on that committee, I can remember seeing the panel, and they were sitting there, and all of it, you know, suddenly I saw heads nodding because they too have experienced it in one way or another. And that's where the heart is. That's where the results happen.
Mm-hmm. I was just going to say, kind of just bouncing off what you were just saying, Bonnie, I remember, I don't think you were with us, Suzette, but when we were in Washington, D.C., you were talking to a different lawmaker. We were talking to a lawmaker there. He's since retired. But with this issue in particular, when it comes to Alzheimer's and dementia, it affects more people than you realize. They just don't talk about it. And this particular lawmaker started talking about his father-in-law. And, you know, so it did touch him personally. And so I think when it comes to this particular issue, you are going to find more people who have been touched by it, whether it's an in-law or parents. And I think that's an opportunity to connect right there, if you can.
Yeah, they're relating to you. And I hate for us to think of it as that we're walking into an office or making a phone call or sending an email and trying to sell them on something. But at the end of the day, you know, you kind of are. And one of the biggest reasons why we buy things is because it's relatable, right? If Kathy comes to me or I see Bonnie with this awesome new app on her phone, maybe I wouldn't have seen a commercial and been interested, but I'm seeing my colleague and friend using it. I'm like, wow, that's something I could benefit from. So like Kathy said, you've got to ask, or I guess I'm saying, the reason why we found that out is because we would always ask, you know, have you been affected by Alzheimer's or any form of dementia? And a lot of times that was when you got that story relatable and they were really joining the conversation, and then we became the resource. We're giving them information to help their family, and it turned the tables.
And that's the most important thing, Suzette, is that we who are experiencing any issue, we are the experts. And the people at the legislature and Congress, they work for us. Mm-hmm. And they're just like us. So it's kind of daunting sometimes to walk into an office or to make a phone call because we think that they know so much more. But we are the experts. And when we leave those meetings, the important thing is that they know that and that they can call us as their resource person.
Yep, absolutely. And I think it's only those first few calls and meetings. Then you start to kind of, you know, get your skin a little thicker and you feel a little bit better about it. So getting through that is good.
But you're right, it's all about relationships.
So definitely a great case for why this is important. I think in my experience working with legislators, it's making that connection with them. Not all of them have been impacted. Many of them have been, but those who haven't been, I think, Kathy, as you had said, it's so impactful to find out how many people are touched by one diagnosis of dementia. It's not just that individual. So, Suzette, I think you started a great transition of talking about creating that relationship, and those first few phone calls are so stressful for you. For someone who's never contacted their legislators, how do you even start this process? Is it picking up the phone and starting a conversation? Is it sending an email? How do you start?
You know, everyone's different. Some people they've got so much energy and assuming they've narrowed their story down a little bit, like Kathy said, some people are ready to just go in and meet people face to face. But I think most of us, we might want to do that, but it takes some time to get there. So I would say find a partner, you know, or a group of people or an organization to get involved in. I think that's always nice because then you're going to be listening in on, you know, how Bonnie's meeting went and the things that she said, and wow, that wasn't that bad. And, you know, so it helps empower you. But the first thing I did is I got on the mailing list for the National Alzheimer's Association public policy mailing list. Maybe that's it. So if you go to the alz.org, you can click in different areas and get on their mailing list, and then you pick your interest. And I really like that because it emails you, it still emails me, an update on whatever it is that's going on out there, and it says, you know, we need you to contact your local legislator. Click here, and it auto-populates based on your address, which mine's already in there because I've done it before, who my senator and representative is. And then the email's already created. I can add something personal if I want to, which I started without doing that because I was nervous. And then over time, I would make it more and more my own, and then I started just sending my own emails. But the biggest thing is, and we've learned this, you know, the more emails they see that say that bill number or that topic, they're like, wait a second, what's going on here? Why are we getting so many constituents that are hot on this topic, or voicemails, or Twitter hashtags? I mean, they're seeing that.
Mm-hmm. And so it's important to come in attached with a bill number. Do you need knowledge of that beforehand, or can you just go and say, I'm a caregiver and this is my story?
That depends. I don't think you need a bill number unless you're working with an organization that has a particular bill. But if you have a particular issue, it's best really, as Suzette said, to work with someone to fashion your story, as Kathy said, and to get that down so that we're not talking about from birth until death. You know, it's like
you lose that.
It's called the we call it the elevator speech, where you can say what you want and catch them in like a minute or 2 minutes.
Mm-hmm.
Well, and also, like, I've had the experience, this was many years ago, when Chad Campbell was in office. I can't remember what his role was. Whip? Minority? I can't remember. Anyway, I was at a Starbucks, and I saw him, and I introduced myself. And then I was like, I'd love to share some information about, you know, the Alzheimer's Association, what we've got going on. And he was like, well, let's meet next week, and, you know, just meet me here at Starbucks. So it was really, like, super informal and weird in that sense, because I'm like, what should I just go up to him? Like, this was like, I think my second time doing this. The first time I actually went with Suzette. We were volunteers with the Alzheimer's Association, and we went to Pasteur's office, and I was so nervous. So, like, I was so scared because, I mean, it can be daunting. And now I just don't care, and I think everyone should hear my story. But anyways, I went up and sat down with Chad, and we chatted, and I actually had a very brief video of my mom playing with this, because her disease was one where she was sort of regressing. I kind of liken it to the movie Benjamin Button. And so she would be attracted to toys, like toys that toddlers would play with. And I showed him this, and he was so, I don't know if he was moved, but I think he was like, why is she doing that? Like, what's happening? And, you know, I think when you have even something like that, like demonstrating the effects of this illness or whatever illness, you know, you're facing, I think that's really compelling, because it's heartbreaking. And, you know, so in that case, I just went up to him, like, and you know what, and at the end of the day, the worst thing he was going to say to me was, no, I don't have time. And if no is the worst thing that, you know, someone says to you, well, that's not a bad thing. Mm-hmm. So I think be bold and be courageous, but also be respectful, because that's really important too. Because I think a lot of us do get passionate, and sometimes that passion can turn into frustration. And I think it's important to be respectful of your lawmakers' time and the fact that they don't want to be accosted. So, I mean, they don't. I mean, they don't want to be faced with anger. I think, and that's, you won't get anywhere with that.
Right. That was something I wanted to mention too. Don't get mad. I always try to remember, if I start to go that way, I may not suck back the tears, but I'll remind myself to get literal and provide the facts. Because at the end of the day, I think now, what are the statistics? It's half the population almost over 85, or 1 in 3?
I think 1 in 3 over 80.
1 in 3 over 80. I mean, this is serious. So even if someone tells you, oh, I've never been affected, they need to realize that they are very lucky. It's rare that they haven't been affected, and it's coming.
And it's expensive. And I think that's a really compelling story, is the cost.
Yep.
To me, if you have people who are, you know, active members of the workforce leaving to become caregivers because they can't afford someone to come to their home. And one stat that I think was really, when we talked to some folks that I threw out, because I think this is really, because money is an issue, right? And that's what they care about. You know, am I going to put my name on something that will require more money? Is the cost of assisted living facilities. The average cost, I think, in Arizona is around $3,000 to $5,000. Maybe that's changing a little bit. When you say that per month, I mean, I think that same lawmaker that I was referring to earlier, even he was like, wait, what? Mm-hmm. You know, that's a ton of money. Most people don't make that in a month who are working full time. How are you expected to pay that if you don't qualify for a service like Altex? So, you know, it really does. I think that's a really compelling point when you throw a simple number like that. I think a lot of people, to this day, I use that figure, and people are like, seriously? Yeah. And that's for your average, you know, not some fancy assisted living facility. Mm-hmm.
Mm-hmm.
And so we've definitely kind of transitioned into this next topic after how do I begin? How do I craft that impactful message? And we've mentioned things like don't get mad, try to keep your emotions in check, maybe sprinkling some statistics in there. Mm-hmm. What other strategies do you guys have?
I would write down your story. I think you need to write down your story, and you need to be an editor and edit your story. Because I think when you first throw up your story on paper, it's probably going to be quite long, because there's so many moments where you're like, and then this happened, and then this happened, and then this happened. And then I think from there you need to start sort of determining which one is, you know, not necessarily finding value, but kind of whittling it down. But I think it's really important to write it down, because maybe you need to see it.
Probably very therapeutic just for yourself to write that story down.
And then from there begin editing, and maybe ask a friend like Bonnie, read my story. What sort of catches your attention? And there might be a moment where you had something happen, and Bonnie might say, "Oh my God, you went through that?" And that might be your story.
Yeah.
It's really important to be trained to tell that story.
And then practice
I was
your
just
story.
going to say, rehearse it out loud.
And
Just-
have,
Yeah, because it might end up being, you know, a 6, 7, 8 minute story, and you just don't have time. Those meetings with policymakers, it's usually 15 minutes or less. You could be standing in a hallway. You could be running into them at Starbucks. You want to be ready to share that. So rehearsing out loud, Bonnie, that's,
yes. Yeah. But, you know, we individually, personally, really, it takes someone else to tell us what they really heard. So it's very important to work with someone who knows how to tell those stories and knows how to sprinkle the facts.
That's a good point. I know when Kathy and I first were going on those meetings together, there was things that she wouldn't share, and I'm like, you need to tell that, you know, or, you know, that came off, you seemed really angry. That's, you know, that kind of lost some of your message. It's good to critique it like that, because then one of you, Kathy or Bonnie, said it's therapeutic. I think that's another thing too. You know, what happens to us caregivers after the fact, after we lose our person? You know, this is a form of therapy, and it's been something that since my grandma's been gone, I mean, every time I tell that story, it helps me remember her, and I feel like I'm advocating for her, even though she's not here anymore. I'm going to make a difference for other families, and you know, you're helping yourself too. So I really that rung home to me.
The story's important, but the facts are also important. And it's also important to be able to make some suggestions about what we think the solution could be. But
your ask.
Yeah.
You have to have an ask. What's your ask? What's your point of being there?
Why are you here?
Yeah.
Why? You just come to tell me your story? No.
No.
I've come to say, this is what's needed in our community to make our community more family friendly, to take care of all of us.
Sure. And the statistics are great, and luckily they're really easy to find. I mean, I just hit Alzheimer's facts and figures, and immediately I got a whole bunch of statistics. You want to go to trusted sites, but you know, if you're meeting with the state senator, you can go in there and say, you know, there's this many people in Arizona living with this disease. There's this many unpaid caregivers that are estimated at, you know, losing this much money or whatever, unpaid caregivers. And he's going to hear in his head, wow, these are potential voters. Wow. You know, are these people calling my office for constituent services? You know, so you're kind of adding the statistic to your story, and then hopefully having an ask too.
But maybe the people listening don't exactly know where to start, I'm thinking. I know AARP has a lot of information, and all you have to do is contact their office. We have phone numbers, but I'm not sure if we can do that. AARP is doing a day at the legislature on January 30th from 11 to 1:30. And there you can informally meet with your legislators at the luncheon, or if you contact AARP ahead of time, they'll help you to figure out how you can even set a meeting with your person that day, and who that person is, because many of us start out this and don't even know who are our representatives, who is our senator at the state level.
And I'm finding I have a completely unnecessary role in this call. You guys are doing all of the transitions for me. And so the last question that I wanted to pose to all of you, which thank you for bringing up the day at the legislature at the end of the month, how can I get involved? We talked about the importance of getting in touch with other organizations. What else can we reach out to and get involved in?
Social media. Social media, I think, is a big one. A lot of these lawmakers are connected by Twitter and Facebook.
If you want to look up our group, CADA, the Central Phoenix Advocates for Dementia Awareness, we're not a big organization. We're a community group. We're run by, Kathy, myself, and some other friends. So whenever you look us up on Facebook, you can follow us there. You'll see all of our events posted. We have one coming up on January 29th. It's going to be at the Beatitudes campus. We're going to be holding it there. It's going to be in the evening from 5:30 to 7:30, and we're going to be having Dr. David Kuhn, Associate Dean and Research Initiative Support and Engagement for ASU. So he's going to be covering brief overview of strategies to reduce stress and more effectively caregive. So we usually do a social. We try to do that every couple of months or every month. We try to do something every month, but that's our next event. So that's going to be January 29th. Look us up on Facebook. You can always reach out. Heather, can they reach out to you and you'll have more details? So if you're not on Facebook, you can call Banner Alzheimer's and ask for Heather Mulder and she'll hook you up with us. And then you'll have just meet with other people. I think supporting your own journey, whether you're in it or it's after your caregiving journey, just staying connected.
There's also a 1-800, but it's a 188 number of the Arizona Caregiver Coalition. And there are people who staff those phones every day. They may not be able to answer your question right then, but you can leave your information, and that's the Arizona Caregiver Coalition. And the hotline number is 1-888-737-7494. That's 1-888-737-7494. So just give them a call and they can send you wherever you need to go.
That's great.
Perfect. A lot of great resources, and I would be remiss if I didn't mention the Alzheimer's Association as well. It has federal initiatives, which you can learn more about through their AIM or their Alzheimer's Impact Movement. And there's also local initiatives through their Desert Southwest chapter. I want to thank Suzette, Bonnie, and Kathy for sharing some of your incredible knowledge on this topic today. I think the take-home messages that I got from each of you was this is incredibly important. It can be therapeutic, and it's really not that hard. And there are places that you can go to get involved. You don't have to do this by yourself.
Absolutely.
So thank you, all of you, for sharing your time with us today.
Thank
you.
Thank you.
I want to invite our participants to join us next month on February 21st, where we tackle the question, how can I ensure my person receives the best possible medical care? I do want to thank all of you for attending our reformatted version of the Dementia Dialogues today. As a note, this session has been recorded and it will be posted on our website shortly after the close of today's session. Also, when we close the session, you will receive an evaluation over email. Please do take a few minutes to fill that out. Let us know what you thought of today's session and what you would like to learn about in the future. Thank you for joining Dementia Dialogues today, where we bring the dementia education to you.